Welcome to the Weiser Center for Prostate Cancer, a sanctuary for hope where you and your family can thrive, from diagnosis through treatment, with patient-centered care from our team of experts and the wisdom of advocates and former patients.
You're going to get the latest and greatest from a technology standpoint, but it's also going to be blended with your input on how best to achieve the goals that you want to reach, because ultimately it's your health and we want to do the best for you.
One of the questions that we often get, or one of the comments that we often get, is I didn't really know what to expect. The idea is we gather information about you, the cancer situation, the priorities that you have, and often with prostate cancer, many times men get a chance to step away, reflect with their families what's important to them, and then we really make a decision together.
You know, the first visit here is probably the most scariest one. You're not actually sure of what's going to happen, but the doctors and the nurses and the receptionists make you feel comfortable as possible. And I think you need to come with a list of questions and an advocate with you, because you're not thinking correctly. You're not necessarily hearing what every doctor and every nurse is saying to you.
In terms of preparing for that first visit with a urologic oncologist or a radiation oncologist, I think it's just fine to walk in not having done any homework. There's nothing wrong with that. That said, if you want to do homework, we have immense resources that are going to help understand, key questions like, what can be learned from my prostate biopsy? What are the risks of different treatments? And using those resources, I think, can help somebody come to the clinic a little more prepared, having those written questions to make sure that we have tried to address all of the really important things for you, for the patient who's sitting there and their family. I think that can be really helpful.
Take a notebook, write it down, use your voice memo on your cell phone, however you want to do it, to be present. Taking notes, asking questions with regards to treatment, side effects, awarenesses that, again, the cancer patient themselves may not be fully focused or aware of because, again, they're sick.
That's part of our multidisciplinary clinic, is when we go into a patient's room together, we talk about shared decision making. Shared decision making means that we're going to listen and we're going to understand where the patient is coming from. We're going to understand where their partner is coming from and the rest of their family. We're going to give some expert medical advice into what might be the best plan of care. We're going to rely on our pathologists, urologic oncologists, and our radiation oncologists, along with our nurse practitioners, radiologists, so we know everything we possibly can know about that person's prostate cancer. But that's only one piece of the puzzle, and we're going to together come up with a management plan that's the best possible plan for that patient.
Instead of having one provider say, I think that this treatment is in your best interest and that's the only option. Instead, we take a different approach and say, here are all the treatment options that might be available to you, whether it's radiation or surgery or ablation or active surveillance. And the patient is then asked, based on the risks and benefits that have been presented, which one do you think best aligns with your needs? Now, different patients emphasize things differently. Some might emphasize a particular side effect. Some might emphasize cure, or some emphasize the likelihood of avoiding any residual cancer after a treatment. And taking all those things into consideration, we can make the wisest decision as a team about what's in the best interest, again, for you, the primary stakeholder. And your voice is heard just as loudly as every other voice in the room. In fact, probably more so.
In order to pick the best treatment for a patient or help a patient understand what treatments they may have in front of them, it's best that we understand what their quality of life is before we see them. In order to do so, we use quality of life forms that fill out what's your urinary function, what's your bowel function, and what's your sexual function. So that gives us a baseline, that gives us understanding how the patient is before we see them.
We make a very personal approach to the assessment, recognizing that people are going through a tough time and attending to the emotional aspects of it all, in addition to just information exchange. We have a long discussion about what were their biggest concerns and fears, what were their expectations, and gradually as I get to know them, I have a feeling for what it is they're going to need, and I'm always checking in with them, saying, am I getting this correctly? Is that what you really need? And what else are we missing that maybe you need to tell me about?
Meeting with patients and their families in clinic can be a stressful time for them. We have the tools to understand what we're dealing with. and really provide some hope going forward in terms of curing their cancer and preserving their quality of life.